I'm Bob Korngold. I'm Chairman of Research at Hackensack University Medical Center. I'm a basic scientist and more recently a translational scientist in immunology. I've worked with the Blood Marrow Transplant group at Hackensack for many years now. And I'm also the editor-in-chief of the Society's journal, Biology of Blood Marrow Transplantation. I've been the editor since 2001, and it's been quite a while. So impact factor is a means of trying to judge the quality of journals, but really it's broken down to the number of citations in any given year and references to your journal in the 2 previous years. So it's a little bit of a game in trying to weigh in on impact factor. Some people consider it more important than others. Particularly in Europe, it's considered more valuable for your curriculum vitae to have journals, publications in journals with strong impact factors. I think it's much more important, however, to be able to get your manuscripts seen by people that you consider important in your field. And I think BBMT has always been a good base for really having your thoughts and ideas and manuscripts seen by the readership, which is the whole society. I think it is read constantly by its members of ASBMT. So everybody that you want to reach in the field is there. So it really doesn't matter as much what the impact number is, because we're a small niche journal, and small niche journals don't usually have really tremendously high citation indexes because it's hard. It's hard because you're so focused on a field. So I think BBMT has done quite well despite that, and we are proud that our impact factor is higher this past year, but it's really more important who you're reaching. So we've been in the 3 to 4 range for a number of years, and this past year it jumped up to 4.7, which is the highest it's ever been. I think part of that is due to some very strong manuscripts that we published, some series. We've had several consensus reports from NIH-sponsored groups involving chronic graft versus host disease and relapse and outcomes. Those are strongly cited usually, because they're a tremendous resource for the field. We've also had some very strong review articles and other things of that nature, guidelines that are important for the field and that everybody should be reading and should be referencing. I've always encouraged people to submit articles to BBMT. But I think it's for the reasons that I cited before. If you're a young investigator, you're relatively new in the field, you can be distracted by impact factor numbers, but you have to really think of who you're trying to reach and who you want to be known by. And again, the best way to do that, if you're publishing in the field of blood marrow transplant, is to publish in BBMT. You're going to be read by the leadership of the field and those important in the field for advancing your career. Yeah, it is not difficult to submit to BBMT. It's all electronic. Elsevier has a platform which works quite well. Everything is submitted, and uploaded. And then it's sent on to an associate editor to handle, and they assign reviewers for that article, and everything is followed and prompted accordingly so that we try to move things through the system as fast as possible. Well, honestly, we would always like to see more biology articles in the basic sciences of the field, or more articles on biomarkers and the new cell immunotherapies, CAR T cell products that are handled by people in the field. So yes, we like to see expansion in those areas. But we're very strong on clinical trial results, major outcome papers, and that's our strength right now. So from the report from Elsevier, we have a wide viewing. We do get a lot of citations from abroad as well, and we have access available through Science Direct worldwide in hundreds of medical libraries. So I think that's an important statistic, that we have a broad readership. It's not just in the United States, of course, but we have viewers from at least 40 countries participating and pulling down articles from our website or from Elsevier's website. So I think it has been doing well, and I think it serves a strong purpose in providing information in the field.